Welcome back to our channel. We provide you detailed information on medicines and drugs to help you inform your health. In today's video, we can talk about Torsinex Plus Tablet, weak coverage, uses, benefits, side effects, how to use and how it works. Let's get started. Manufactured by Micro Labs Ltd. Torsinex Plus Tablet. Uses. Torsinex Plus Tablet is used in the treatment of hypertension, also known as high blood pressure. It is also used in the treatment of edema, which is the buildup of excess fluid in the body. Benefits. In hypertension, high blood pressure puts extra strain on the heart and blood vessels, increasing the risk of serious health problems. Torsinex Plus Tablet helps lower blood pressure by removing excess fluid and relaxing blood vessels. This reduces the workload on the heart and helps maintain effective blood pressure control while minimizing potassium loss, supporting better heart health and overall well-being. In edema, the medicine helps reduce swelling caused by fluid buildup due to heart, kidney, or liver problems. It increases urine production and removes excess salt and water from the body. This helps maintain balanced fluid levels, relieve discomfort, and improve mobility and breathing. Side effects. Like all medicines, Torsinex Plus Tablet may cause some side effects. Common side effects include headache, inflammation of the nose, muscle pain, dizziness, and frequent urge to urinate. Some individuals may also experience abnormal ECG, gastrointestinal disturbances, increased liver enzymes, diarrhea, memory impairment, and pain during periods. If any side effects persist or worsen, medical advice should be sought. How to use. Take Torsinex Plus Tablet exactly in the dose and duration advised by your doctor. Swallow the tablet whole. Do not chew, crush, or break it. It should be taken with or after food. How it works. Torsinex Plus Tablet works by removing excess fluid from the body while maintaining potassium balance. Torsinemide is a diuretic that helps the kidneys eliminate extra salt and water, reducing swelling and lowering blood pressure. Spironolactone is a potassium-sparing diuretic that prevents excessive potassium loss while also helping remove excess fluid. Together, these medicines treat conditions like edema without causing major electrolyte imbalances.